Welcome. I'm Dr. Catherine Y. Brown, your host. And if you've been following my journey, you know that I'm on the road to interview 100 people, patients, caregivers, medical professionals in the community to learn about those two words, pulmonary hypertension. And I'm doing this work in honor of my late mother, the Roberta Baines Wheeler, who was a nurse for over 40 years. She was diagnosed with pulmonary hypertension and continued the work until literally the night before she transitioned. And her last words to me before she went to sleep that night were to continue the work. And so I do this in her honor. Today, I'm excited to introduce you to Leslie Pulse. Welcome, Leslie.
Thank you. Glad to be here.
I am so excited that you have agreed to be here with me and to share your journey with all of our viewers around the world. So as we begin, can you please share where you're joining from, where you located, and a little bit about Leslie?
Sure. I live in Westchester, Pennsylvania, which is kind of a suburb outside of Philadelphia, down in the southeast corner of the state of Pennsylvania. I was diagnosed with PH over 18 years ago. I'm coming up on 19 years, actually. I was diagnosed after several misdiagnoses, like a lot of people. I was put on oxygen immediately, and I was prescribed the first oral medication that came out. It had just been made available when I was diagnosed. So I went directly to the oral medications. I work full time. I continue to work full time. I'm a technical writer for the software industry. That's a little bit about me.
Awesome. So when did you first hear those two words, as we said, pulmonary hypertension, and what was the process like in terms of the correct diagnosis and the best treatment options for you? And we know the treatment options can change sometimes through the journey.
Well, the first time that I heard the words, I guess, was when I was in the hospital. My GP had sent me to the hospital because they had seen something on a test that looked like there was something amiss with my heart. And so I was actually in the hospital going through this diagnostic process for about 10 days, I guess. And they went through the process of elimination. They checked thyroid, they checked, all these other things, did all this blood work, and they keep coming up with negatives. It's not a lung problem, it's not a heart problem, it's not a thyroid problem. And they told me eventually that, I remember the doctor was sitting at the end of the bed drawing on a piece of paper to explain what he thinks is going on. And he said, we think it's this thing called PH, but we've never had a case. We've never seen a case. So you need to go to someplace where they specialize in this and can do a diagnostic test for you. I guess he was referring to the right heart cath, which is the gold standard for diagnosis. And so they sent me home on oxygen, and with a sort of a vague referral to a hospital in Philly, in West Philly. So I had to call and make an appointment and wait a couple of months. And this went from May, this was in May, and it became October when I finally went in for my right heart cath and got the formal diagnosis.
So after you got the diagnosis, how long was it until you got the correct treatment? Because that doesn't always line up the same for everyone.
Well, I am one of the rare calcium channel blocker responders. So I was put on calcium channel blocker right away, and the doctor ordered this new medication, Tracleer. And so I was put on those two right from the very beginning. And it made a big difference, eventually, once I got used to the side effects and everything else. So I have since added another drug, but I'm still on both of those.
Okay. All right. So in terms of just keeping with your daily routine and things for you. How have things been?
Well, I try to make pH as small a part of my life as I can.
Mhm.
There are those days, 2, 3 times a year where I have to go into the pH clinic and do my testing. Um, I have to be organized about my oxygen supplies. I have to order tanks, and when I travel, I have to make extra arrangements. But other than that, I really try to not let it um, make me sit things out. I work full time, and I'm in a job. I'm in an industry that's very volatile, so I've changed jobs 3, 4 times in my almost 19 years with PH. So I've gone job hunting with an oxygen tank, and gotten new jobs, and I don't think that I present as being sick.
Mhm.
And I just try to minimize the impact that it has on my life. I mean, it has an undeniable impact, and once a week I have to sit down with my bushel of medications and parcel them out for the week, but then it's done. And so I know, morning and evening, I just take my medication, and, I don't have to see the bushel of medications
Right.
every day, Um,
Absolutely.
I've got a stack of tanks behind me here, and I get new tanks every 6 weeks. So it's not something I have to deal with all the time. Probably the most onerous aspect of it is dealing with health insurance and medication from specialty pharmacies. That's the most onerous aspect of it for me.
Absolutely. Leslie, I want to make sure that for our viewers that may have gotten a diagnosis and said, okay, what is life like? Because really you give people hope. The fact that, like you said, I've went and you say you got job interviews, and so it hasn't stopped you. And I want people to hear that and to hear your story, because that's so important. When you mentioned the pharmacies and medications, some people have shared with us that the medications are in some instances for some $10,000 a month. Obviously it can vary, but what has that been like for you in terms of working with the specialty pharmacies?
In one word, I would say ghastly. I mean, it's hugely expensive. Um, for most of my time with PH, my health insurance through my employers has been phenomenal and has taken care of it. I just have to go through the red tape to get it.
Mhm.
However, every time I change jobs, my health insurance changes, and of course, all my suppliers change. And unfortunately, in my current job, my health insurance is not as good as it has been in the past.
Mhm.
So now I'm getting one of my medications through GoodRx, which I have to, make special arrangements to drive there once a month. The other medication is now costing me, $200 a month. It's just a lot of red tape and um, making phone calls and trying to organize it. Again, I try to compartmentalize it and, pick a day when I'm going to do that, and know that it's going to be um, upsetting and degrading and infuriating. And then I leave it behind for that day and go on and try not to think about it until the next time I have to deal with it.
Absolutely, absolutely. What words of wisdom or encouragement would you give to someone? Because that story is really common, Leslie, and some people might be newer in the journey and may not know how to advocate for themselves and what that looks like. Because, and I want to pull something out. To me, it's the way that you structured it. You said, I pick one day a week. And so it's really important for people to understand, like, don't make it your, even though you might think about it, but how you structure it. And to me, so that you manage the situation and it doesn't manage you.
Yes, and I just attended the PH International Conference a couple of last month, and I did attend a session that was focused on advocating for yourself. And the theme that they hit was, you're a partner in your own healthcare. You're not, you know, how I interpreted that is, you're not just at the whim of everybody else. You know, you have some agency to manage the process yourself. I'm used to doing research, and so that's my way of kind of exerting some control over my situation. I do a lot of research about things. I want to know the language, the terminology. I want to understand the process, so I can judge for myself if what I'm being told or asked to do is reasonable. And I can ask further questions. I don't, just accept what people tell me if I think there's a better answer. Now, I'm not always successful. And one of the presenters at this session said that, she occasionally has like a preemptive cry before she has to start making these phone calls just to get it out of her system, because it's going to be infuriating. And, you don't get anywhere if you fly off the handle, but you can be persistent.
Absolutely. Don't give up, be persistent, and continue to advocate for yourself. Our mantra is awareness, empowerment, and hope. Together we can make a difference. When you hear that mantra, what do you hear? And maybe does it inspire you to maybe share something with those that are viewing?
Well, I don't know if this is what you're looking for, but I don't consider myself a very spiritual person. I'm more I'm just more bloody-minded, I think. I am intent on doing certain things. I put up with the stuff that I can't control, but I do things on the side that sort of even it out for me emotionally. I do a cartoon strip. And so when these horrible situations come up and I have to go through all this stuff with the insurance companies, I kind of get my own back by doing cartoons about it. So I get my secret revenge.
So let's talk about those cartoons about it.
Yeah. Well, I've always been a cartoonist, I've always cartooned. And so it was a natural go-to for me as a way to sort of deal with this. I mean, when you get this diagnosis, it's a lot of upheaval and a lot of change, and there are a lot of indignities involved in getting the diagnosis and figuring out how to live with it. And so I started doodling cartoons about it. It was just my way of handling things. And I started showing it to other people, other patients. I was in a sport group at the time, and they seemed to find a use for them as well. Express some of what they were going through. And so I started posting them online for a while. Just as kind of a way of, it was a sort of a non-threatening way to let other people have a glimpse of what it's like to live with this disease, as well as, I sort of use it as a way of handling current situations too, because I think, this really sucks right now, but I'm sure I'm going to get a good story out of it somewhere, So I always kind of have that in the back of my mind when I'm going through stuff. So.
I love it. So one of our target audiences is, we do patients, caregivers, medical professionals, and the community. I hear a lot of patients talk about how much they have to advocate for themselves, really educating the providers, because sometimes in their journey, they may run into a provider that's not maybe as knowledgeable. So what, if you could say any words of wisdom or encouragement to the medical community, what would it be? Because there might be a future respiratory therapist or physician watching, a student who's watching it, and they're early in their journey, and there's something that they could hear and learn from your experience, Leslie.
Well, I like to think of the way that my current PH doctor handles things. And I would say that it's not to pay attention only to the disease, but to the whole person. It's more than a bundle of symptoms. There's a real life person involved, and every person has their dreams and their wishes, their to-do list, their bucket list, whatever you want to call it, and finding a way to help the patient achieve a quality of life where they can go out and do those things for themselves, I think is the important thing.
Absolutely. I love it. I have asked you so many questions today and you have been so kind to answer all of them. So my final question for you, is there anything that you want to share that I have not already asked you?
Well, I think that for a rare disease like PH, I think that reaching out to find other people who have the disease has been very beneficial for me. In the beginning of my diagnosis, it was important to me to meet other people with the disease because I could gain insight from how they handle it. Now that I'm more on the veteran side of it, I think it's kind of it's useful for me in another way to be involved with the community because I get to give that knowledge to other people who may be newbies or maybe struggling. So I think that being involved with communities, with the PH community, is important for those reasons.
I love it. And, for those of you who are watching, there are many organizations that are trying to do good work. And if you are a person who wants to start an organization, I say you should, because you cannot have too many people working to try to increase awareness. We started the RBW. I condensed it because my mom's name is so long, but RBW PH Awareness Group. We started doing the work in 2012 and then became a 501 in 2014. But there are many new organizations that are coming. But to your point, Leslie, there is a community and no one should ever have to feel as if they're dealing with this alone. And I only say that because your words resonated with me. I do remember when my mother was diagnosed. She was a nurse for 40 years. But you don't really learn about those two words sometimes until the diagnosis. So if you're watching this and you've just met the amazing Leslie, take those words to heart, that find a community. There are several nonprofits now out here, doing work, but just know you're not alone. And I know in our situation at our medical facility, there were support groups, and then a lot of times providers can make recommendations, and the nurses became like family. I don't know about you, Leslie, but sometimes the providers, they feel like it's cousins. Maybe they shouldn't, but they do after a while, right?
And I think also that it's a hopeful time for PH. There's a lot of research going on.
Yes.
That's another reason to be involved with the community, is to stay in touch with what's happening and to learn about what new research is coming. When I was diagnosed, there were maybe 2-3 medications, and now there's 14 or so. And the information that's out there is just very hopeful. The research that's going on, they're making progress.
I love it. So there's hope for us, one day at a time. Leslie, thank you so much for being here with me. I appreciate you for sharing your heart, your wisdom, and your journey with us. And it makes a difference. And I think it's going to take all of us, me to have the courage to continue this work, you to continue to be the veteran voice of the community, sharing it. For our viewers around the world, please share this message and connect with people. And if this is the first time you have heard those two words, pulmonary hypertension, share this on your page, email, text family members, because we need to make sure that more people know those words and what resources are available. So until next time, I'm Dr. Catherine Y. Brown, your host. Thank you for joining. And thank you, Leslie. I'm sending you a virtual heart.
Sure.
I appreciate you.
Thank you. Thanks for doing this.
Oh, yes.